In this segment, I want to talk to you about what you can expect from my staff and as far as your care goes on once you arrive to the floor after your surgery. So when you wake up and come up, you're going to have on what we call SCDs on the floor. They're sequential compression devices. They're green wraps that go around your legs. And what they do is that one pumps up and one lets off, and they rotate back and forth pumping. It simulates you walking and simulates the contraction of the calf muscle to help keep the blood flowing in that leg really, really well. And it helps to reduce the chance that you may get a blood clot. Another thing you'll get along with the green wraps is you'll get what we call TED hose. That's the long white stockings that come up to your knee that are really tight. You'll have those along with the green wraps. In a combination of those two things, they're going to reduce the risk of you getting a blood clot in your lower extremities after your surgery. So once you come up, if you have a knee, one of the focuses we do is we do cold therapy on both joints, but with a knee you get a cold wrap, a cold therapy unit. And what it does is a wrap that goes around your leg from just above your knee to below your knee, and it's hooked up to a cooler. It circulates cold ice water through the pad. And that helps to reduce the swelling in your leg. Part of reducing the swelling, it's going to reduce some of the throbbing pain. So we encourage you to use it. We actually want you to use it once an hour, every 4 hours at the minimum for the first few weeks after surgery to help reduce that swelling until swelling normalizes. And you'll continue to use that unit once you go home and all the way up to 10 or 12 weeks. If you're, as time goes on, you'll have to use it less and less, but as you get out and about each day and you get more active, you're still going to have swelling out to 2 to 3 months. So in the evening time before you go to bed, we'd want you to put that unit on, run that cold water through there, reduce that swelling. It's going to reduce your pain, and it's just going to help your overall recovery time. Now with a hip, you're going to use ice packs. So we'll fill ice packs and we'll just apply them directly to the area of the hip where the surgery took place. The big thing about ice, I tell everybody ice is your friend because it does reduce swelling, and it does, by reducing the swelling, it reduces that throbbing pain that you have, and it also numbs that area, so it's going to help with your pain in that way too. So one of the other things that we're going to do with you once you get to the floor, take a second. All right, so one of the other things we're going to do with you once you get to the floor is there's always a possibility that you may lose enough blood during surgery that you have to have a blood transfusion. You get typed and crossed for blood during pre-op, and we don't have to do it very often, but there is always an opportunity that it could possibly happen. So if you come to the floor and your hemoglobin's a little bit low after surgery, then you may have to receive a unit or two of blood. We'll do everything we can to reduce that chance and make that as a good transition as possible. So one of the safety things that we look at after surgery is your risk for developing a pneumonia. As you're inactive directly after surgery until you get back to being active, your risk for developing pneumonia with any type of surgery is increased. So as you walk and you move daily and just have your normal activities, your breathing is increased. It helps to open up your alveoli and push out secretions that build up in your lungs. Once you get those, get active again, the risk goes away the more active you get. But those first few days after surgery, you're really struggling to get back in and doing the things you're normally doing. You're not nearly as active as you normally are. So what we'll do is we'll bring in what we call an incentive spirometer. It'll be something that you'll do in the room, and you'll take it home with you and continue to do it until you build back up to an active lifestyle at home.